Welcome to the National Standard for Workplace First Aid Curriculum webinar brought to you by the Canadian Red Cross. I am Don Marantet, Director of First Aid Education Programs. This webinar will present the new standard for first aid training for the workplace, curriculum and quality management for training agencies, published in 2017 by the Canadian Standards Association, CSA. This standard is a result of a collaboration between the Canadian Standards Association and government occupational health and safety representatives initiated by the Canadian Red Cross. During this webinar, we will look at why and how the standard was developed, who was involved, what the goals are, what the standard covers, how it will be implemented, what this standard means for workplaces. Each province and territory has its own legislation and regulations that reflect the requirements for workplace first aid. Due to an increased desire for more labor mobility, along with an amendment to the Canadian Occupational Health and Safety Regulations in 2012 that changed the definition of an approved agency. There was a gap left in the approval process as many jurisdictions approve training agencies based on the agency's federal approval. To address this issue, a National Standard for Workplace First Aid Competencies initiative was started in October 2013 when the Canadian Red Cross brought together representatives from each province and territory who were involved with administering workplace first aid legislation. These representatives shared a common desire to explore ways to create safer workplaces. As a result, the Workplace Injury Reduction Collaborative was established to continue the conversation around safer workplaces and to investigate the possibility of a first-ever national standard for workplace first aid competencies. In early 2014, the Canadian Red Cross approached the CSA to develop the standard and co-published the briefing note on proposal for a national standard on workplace first aid training with the CSA. In July 2014, the briefing note was endorsed by the Workplace Injury Reduction Collaborative and by the Canadian Association of Administrators of Labour Legislation, Occupational Health and Safety, CAL-OSH. The standard was developed by the CSA Technical Committee on Workplace First Aid, under the jurisdiction of the Steering Committee on Occupational Health and Safety. The committee had 36 members who were selected on the basis of their skills and experience and their ability to represent one of the three core areas: user interest, regulatory authorities, general interest groups. The committee members came from government, workplace insurance boards, first aid training agencies, labor groups such as London Drugs, and school boards supported by CSA staff. A balanced matrix formula ensured a fair voting process and a collaborative consensus. This new standard for workplace first aid is intended to harmonize first aid content and competencies across Canada with the additional benefits of improving universal practice by first aiders in the workplace, improving course design and delivery, simplifying accreditation portability, setting best practices for workplace first aid programs, setting best practice guidelines for the qualifications for workplace first aiders. The first edition of CSA Z1210, First Aid Training for the Workplace, Curriculum and Quality Management for Training Agencies, covers the following: the minimum requirements for design considerations for a workplace first aid training program, the learner training levels, a matrix of the competency level required for each of the associated learner training levels, the quality assurance requirements for training agencies. This standard does not include workplace first aid training for members of the public, workplace first aid instructor training, specific requirements for specialty first aid training courses in programs such as marine, mining, transportation, pools, and daycare centers where specific legislation could apply. The standard is intended to be used by occupational health and safety (OH&S) regulators, training agencies, and interested workplace parties. I encourage all workplaces to be aware of the new provisions, as these will give you a benchmark to ensure that you offer a quality first aid training program to your employees. Next, I will discuss what the standard includes for the course design, learner levels, competency matrix, and quality assurance. In terms of first aid program design, the standard takes the following elements into account: training environment. The training agency has to accommodate learner practice and demonstration of skills by addressing the safety, comfort, and accessibility needs of learners. Training materials and equipment. The training agency has to establish policies and procedures for training materials, equipment, and infection prevention and control practices. Training course duration. All training courses must include a knowledge component and a practical skills demonstration. The minimum practical skills demonstration must be 3.5 hours for a basic level, 7 hours for an intermediate level, 35 hours for an advanced level. The intended audience. The training agency will identify the intended audience to assist learners and organizations in selecting the required course level. According to the standard, the role and responsibility of the workplace first aider for each training level are basic level, Recognize an injury or illness, inform emergency medical services, EMS, and provide workplace first aid care for the injured, ill worker. Intermediate level. Have competency in the basic training level and provide a broader scope of emergency workplace first aid care for the injured, ill worker. Advanced level. Have competency in the basic and intermediate training levels and provide care for the injured, ill worker with specialized equipment specific to the workplace. The standard specifies the competencies of a workplace first aider in regard to awareness, knowledge, and skill provided at the basic, intermediate, and advanced training levels. Awareness means that upon successful completion of the workplace first aid training course, the workplace first aider will have the necessary first aid information and be able to access other resources about first aid topics. Knowledge means that the workplace first aider will be able to recognize situations requiring first aid and recall information related to first aid topics. Skill means that the workplace first aider will be able to apply a procedure or protocol at the required competency level. Because the workplace first aid legislation differs from jurisdiction to jurisdiction in Canada, it is the workplace's responsibility to determine how applicable legislative requirements relate to this standard. The competency lists are comprehensive, so I encourage you to get a copy of First Aid Training for the Workplace, Curriculum and Quality Management for Training Agencies from shop.csa.ca. The training agencies are responsible for providing documented policies and procedures on the following: the process used to develop and update workplace first aid training programs, the instructional methods that correspond to competencies, the instructor training and qualification process including prerequisites, requalification frequency and process, competency assessment, performance and evaluation, frequency and process, instructor performance management, the learner assessment process including formative assessment, summative assessment, evaluation management process, example, the pass rate, the reassessment options. In terms of structure, training agencies need to have documented policies and procedures that identify the position or development responsible for the development of procedures, content, and quality assurance, specify obligations of third-party providers, specify how quality management activities will be applied in the workplace first aid training. Training agencies will also have to maintain accurate electronic or paper records and securely store them in accordance with legislative requirements for access, disclosure, confidentiality, protection of trade secrets, and privacy. Training agencies will also provide the opportunity to be evaluated by the learners on topics such as delivery of the training course, use of training course materials and coverage of topics, training course duration, example, where the course hours adhere to, application of adult learning principles, sufficient time for feedback and discussion, training instructors' subject matter expertise, training instructors' use of appropriate facilitation skills to meet the needs of the learners, learning outcomes and qualification requirements transparency, i.e., where they explained, made clear. Workplace first aid certificates must be issued only to learners who have demonstrated competency in awareness, knowledge, and skills. Certificates will contain the following: the name of the learner, the level of workplace first aid training achieved, the date of issuance of the certificate, the date of expiration, the name of the training agency, the province or territory of issuance. Although it is a best practice and sought out by industry as a reference, the standard is voluntary. The provincial and territorial legislative bodies have participated in the creation of the standard. However, there are time-related factors such as setting up an approval body and changing current legislation that will influence when the standard will be fully incorporated into the legislation. We know that the industry and labour will play an important part in the adoption of this standard. The Canadian Red Cross will continue to offer support to our government partners on the adoption of this incredibly important step toward achieving safer workplaces. The Canadian Red Cross developed its revised 2017 programs based on the International First Aid and Resuscitation Guidelines and the competency framework platform used in the CSA standard. This means that all of the workplaces that currently use Canadian Red Cross training will benefit from the highest program quality developed so far for Canada. As a conclusion to this webinar, I invite you again to acquire a copy of the Z1210 First Aid Training for the Workplace, Curriculum and Quality Management for Training Agencies from shop.csa.ca. I also encourage you to check out the Canadian Red Cross program information by visiting redcross.ca/workplace first aid. I'm Don Marentet, Director of First Aid Education Programs with the Canadian Red Cross. Thank you.